Now to health matters, the World Health Organization says it has conducted a risk assessment which found that a new EG.5 variant poses low risk at global level. But the Nigeria Center for Disease Control and Prevention still insists that it will continue to monitor situations around the globe, especially in countries where the new subvariants of the Omicron variant of the SARS-CoV-2 virus have been confirmed. This comes on the heels of the discovery of new variants named EG.5 and BA.2.86, which are descendants of the XBB.192 of the Omicron variant. And health correspondent Kemi Balogun has more details.
The new variant EG.5 has already been recorded across 51 countries like the United States, China, Japan, Australia, Spain, and others. It has been classified as a variant of interest by the World Health Organization. So far, only one case of the EG.5 has been seen in Africa and has not yet been identified in Nigeria. The EG.5 variant causes symptoms like those seen with other COVID-19 variants, including fever, cough, shortness of breath, fatigue, muscle aches, headache, and sore throat. All viruses, including the virus that causes COVID-19, change over time. These viruses that change are called variants. These changes can affect how contagious a virus is, how well it responds to treatment, and how severely it affects people. The recently discovered BA.2.86 is a descendant lineage of the BA.2, a sublineage of Omicron, also found in Nigeria in 2022. Recent data shows that 9 cases of the BA.2.86 variant sequences have been reported globally. According to findings by the US CDC, existing tests used to detect and medications used to treat COVID-19 appear to be effective with this variant.
Proud of the COVID-19 vaccination levels that we have achieved. If you look at the data,
the BA.2.86 may be more capable of causing infection in people who have previously had COVID-19 or who have received COVID-19 vaccines. It is too soon to know if this variant might cause more severe illness compared with previous variants, especially with only 9 cases so far detected. It is also too soon to know how transmissible this variant is. The NCDC still advises the elderly, those with underlying chronic illnesses, especially hypertension, diabetes, those on cancer treatment, organ transplant recipients, and those whose immune systems are suppressed to consistently take extra precautions and observe all preventive protocols. Kemi Balogun, TVC News, Abuja.
And a former Director of Disease Control, Lagos State Ministry of Health, Dr. Aniolari Osho, joins us live to give further perspective on the new COVID variant. Good to have you join us.
Well, thank you very much. Good evening. It's my pleasure being on the line. Thank you.
So the federal government has said, and that's the NCDC, has said that it will continue to monitor the situation around the globe. But from your experience, in dealing with infections like this or disease like this in the country, what sort of surveillance measures should we be putting in place?
Well, it's not what should be put in place, but what we have already in place, both at the national level and the state level. I know for one, NCDC has been doing a lot. They have been distributing diagnosis test kits at various levels so that we have bidirectional testing. That means apart from the PCR testing, you can also have rapid testing in various settings, like hospitals, like health centers, and even at homes. So we have that one in place. We also have in place the Sentinel survey for influenza. And those that have influenza, they are being monitored, especially those who have the severe cases and those who have severe acute respiratory infections, they are being monitored. And COVID-19 has come to stay with us, and that is what we all know. So it's not as if it has been eradicated, it's still with us. But as it is now, the surveillance is very strong, that as we are speaking now, there has been no increase in the incidence of COVID-19 in the country, at least in the last 2 years. So the one that we are talking about now, they are not with us now because there's no evidence to show they have any increase in the incidence of COVID-19. So that's number 2, that's sentinel survey. Then the other thing that is NCDC is doing that we're all aware of is that the technical working group of the NCDC on COVID-19 is doing continuous monitoring in terms of epidemiology, both locally, regionally, internationally, continentally, and globally. So that if at any point in time there is any variant, the variant is being monitored. And if the variant is reported in Nigeria, I can assure you that it will be detected. But as it is now, the 2 variants that are circulating now are not in Nigeria, at least as confirmed by NCDC, that we don't have the EG.5 variant, and we don't have the BA 2.86 variant. So we don't have those in Nigeria. So surveillance is very
Dr. Eniola, I just wanted to ask you, I just wanted to ask you about this because we know that generally, just globally, surveillance has been reduced. And we also know that some countries are holding back the booster doses of their vaccines for quite a while just to see how this particular variant will react to vaccines. But are there concerns in that regard, especially for those who have already taken the vaccines?
Well, I can say for certain that Nigeria has not relented its efforts in surveillance. Now, I've mentioned that we are having the sentinel surveillance of influenza-like diseases and influenza, and we are also monitoring the epidemic of the disease locally and internationally. So I know, I don't know of any other country, but I know Nigeria is still very strong in terms of surveillance and monitoring. And I can assure you that if there is any case of any new variant, it will be detected within a very short period. That one is certain. Then in terms of vaccination, well, the vaccination is still ongoing in the country. Nigeria has not stopped. We have various centers, health centers that are actually participating in the vaccination, and we still have some private health facilities too that are still providing the vaccination. So but the vaccination is an ongoing process in the country. It has not been stopped, and I'm sure it will continue. Because I've said, COVID-19 has come to remain with us. So it's only those that have high risk for COVID-19 that we are concerned about and that we monitor, especially the elderly and those with underlying conditions like hypertension, those that have immunosuppression, and those that are receiving treatment for cancers. So it has come to say it's like a chronic disease now, but we don't have the severity that we had in 2020.
Absolutely.
So what we have now is a control something, yes. So, but I can assure you
the WHO has said that this is low risk, and so we'll continue to see how the new developments around this variant. But at this moment, we're asked not to worry because it is low risk. Thank you so much for talking to us, former Director, Disease Control, Lagos State Ministry of Health, Dr. Eniola Eriosho. Thank you.